Assalamualaikum.
Waalaikumsalam.
Okay, right. Just have a look, check around if most of you already in. The presenter can start testing your voices. Presenters can start testing your voice. Can you hear?
Hello.
Okay, I can hear you. Okay, the rest. How about the rest?
Yes, we can hear.
All right. Okay.
Yes, okay.
Okay. I think if most of you around, can we start?
Doctor, I can start now?
Okay, yes, please.
All right. Assalamualaikum warahmatullahi wabarakatuh. I will explain regarding about the immunization. So, what is actually immunization? It is the process whereby a person is made immune or resistant to an infectious disease, typically by the administration of the vaccine. So this vaccine will stimulate the body's own immune system to protect the person against the subsequent infection or disease. So how the concept of this vaccine work is that it by imitating the infection, by activate the immune response to produce the antibody against them. So whenever there is invasion by the germs such as bacteria or virus inside of our body system, so they will attack and multiply inside of our body. So this invasion will be called as infection that might cause the illness, and this will activate our host immune response. So this will activate the macrophage, B cell, as well as T cell. During the first time the body encountered this kind of germs, it will take the several days to get over this infection. However, during the subsequent same infection, due to the presence of the memory cells, hence it will attack it faster and faster. Okay, this immunity can be divided into two, which are active and passive immunity. So the active immunity is antibody being produced by the person's own immune system. Meanwhile, for the passive immunity, it is the administration of the ready-made antibody. For the active immunity, it is slow response due to it requires several times of day in order to produce the antibody. For the passive immunity, it is rapid response. And then for the active immunity, it is long lasting due to the presence of the memory cells. And for the passive immunity, it is vice versa. And then for the active immunity, it is direct contact with the pathogen itself. And for the passive immunity, it is no direct contact with the pathogen. And then, however, the disadvantages of this active immunity is that it is not applicable for the immunocompromised individual. For the passive immunity, it is applicable in immunodeficient individuals. And then this active and passive immunity can be further divided into natural and artificial. So this natural active immunity is that whenever the body got in the infection, so it will produce the antibody against them. For the active artificial immunity, we give the vaccine or toxoid that contain the antigen so that our body will create the antibody against them. And then for the passive natural, which it will be acquired from the mother either before or after birth. For example, before birth is that the mother transfer the IgG via the placenta. Meanwhile, for the after birth, it is via breastfeeding. The mother transfer the IgA via milk. And then for the passive artificial, it is a ready-made antibody, which such as immunization against measles and tetanus, which usually useful against the immediate protection against the acute infection. So next we go to the concept of the booster. During the initial exposure, so our body will produce the antibody, however, it is low affinity. And then whenever we give this booster, it will cause the secondary exposure so that our body will produce the antibody that is high affinity. So the theory why we give this booster to the person is that to boost up our immune response, as its mechanism is by re-exposure to the antigen. Because of what? Because of some diseases are more resilient than others. And then this is because of the memory against the antigens decline over time. However, we have to note that not all vaccine need booster dose, as some vaccine can offer lifelong immunity. The next one, we go to the vaccination timetable schedule that been provided by the Ministry of Health of Malaysia, which during at birth, usually we will give this BCG and hepatitis vaccine to the neonate, which everyone know BCG is to again TB and hepatitis is TB. And then during the second, third, and fifth, we will give DTaP, which is to against the diphtheria, tetanus, and pertussis. And then HIV is stand for Haemophilus influenza B, and not forget to give the vaccine to again the polio virus. And then during the 9 and 12 month, which we will give MMR, which is to against the mumps, measles, and rubella. And then JE is stand for Japanese encephalitis. So this is the vaccine need to be given as according to what have been stated inside of this table. That's all from me.
Okay, I'm going to continue with the presentation where I will be briefly talking about the contraindications of vaccines. So we have two types of contraindication. We have absolute and relative. For absolute contraindication, the examples of a patient who is absolutely contraindicated from being given vaccine. First one is this where the patient has severe anaphylaxis reactions to previous vaccine dose or its component. And the second one, postponement or giving of vaccine during acute febrile illness. For example, if the patient has fever. And next one is relative contraindications. For example, the situation where the patient is whether it's within 2 weeks of elective surgery. So it has been said that research has been said that if the patient is being given a vaccine before or a pre-operative or post-operative vaccination, they will be contraindication. But however, there is no concrete concrete evidence to prove it. So it is put under relative contraindications where we will take extra precaution to ensure and we will take extra precaution and supervise the patient. Next. So for an absolute contraindication, we will divide the contraindication based on two types of vaccine: the live attenuated and killed vaccine. So for live attenuated vaccine, we have many lists of these examples. For example, immunosuppressed children, children who is on chemotherapy or less than 6 months after the last dose, patient who is on high dose steroids, on low dose steroids, patient who is within 4 weeks after live vaccine given, within 3 months following intravenous immunoglobulin, patient who is pregnant, and patient who is on tuberculin skin test and MMR. For killed vaccine, they are generally safe for all conditions except if the patient has severe local or severe generalized reactions to the previous dose of vaccine. Next. So, however, the vaccines are not really contraindicated in these examples, which are first, patient who has mild illness or patient who is afebrile, patient who has asthma, eczema, hay fever, impetigo or heat rash, patient who is on treatment with antibiotics or locally acting steroids, neonatal jaundice, patient who is underweight or malnourished, over recommended age, any past history of pertussis, measles or rubella, and non-progressive stable neurological conditions. So for now, I'm going to continue with the adverse effects of each vaccines that primarily important based on the National Immunization Program, National Immunization Schedule in our country. So the first one is the BCG. So the BCG vaccine, the possible side effects that can come is the BCG adenitis. For hepatitis B, local reactions, for example, swelling, redness or pain, any fever or flu-like symptom in the first 2 days, rarely erythema, multiform or urticaria. Next vaccine is diphtheria and tetanus. They can come with local reactions as well. Any small painless nodule may develop at the injection site of transient fever, headache or malaise, but rarely anaphylaxis and neurological reactions. And then pertussis, they can come with local reaction and it can be severe if it involves two-thirds of the limbs. And they can also come with severe systemic reactions, for example, anaphylaxis, encephalopathy, high fever, fits, and inconsolable crying. Next. And then for IPV vaccine, they can come with local reactions. For Haemophilus influenza type B, they can come with local swelling, malaise, headache, fever, irritability, rarely seizures. For measles, mumps, and rubella, they can come with transient rash and sometimes fever between day 5 to day 12 of post-vaccination, URTI symptoms, febrile convulsions, and encephalopathy. For Japanese encephalitis, they can come with local reactions as well, plus fever, chills, headache, and lassitude. Next. And lastly, for HPV vaccine, they can come with injection site reaction and also fever, headache, myalgia, arthralgia, fatigue, nausea, vomiting, diarrhea, abdominal pain, pruritus, rash, and urticaria. So that's all for me. I'm going to pass to the next center.
Did the presenter started? Didn't hear your voice, huh? Just check.
Just a minute, doctor. The third presenter is having problem with his internet connections.
Hello, test. Is everyone hear me?
Yes, can hear.
Hello, test. Ready for the technical error. Slow right now. So I will proceed. So I will proceed with the additional vaccination which is not listed in the national immunization program. So the first one is this additional vaccination is available in private hospital or clinic. So the first vaccine is pneumococcal. This is a conjugate vaccine. It helps to protect against pneumococcal disease, and it is recommended to complete 3 doses within first year of life, starting 6 weeks of age. So the second one is meningococcal. So meningococcal vaccine is help to prevent from any type of illness caused by Neisseria meningitis. So it is recommended for children traveling to high-risk area. The high-risk area is like the sub-Saharan region, the region which is as high risk area of this disease. And it is recommended and the single dose provide immunity up to 3 years. So next one is the rotavirus. Rotavirus, as we all know, it is a virus that can cause severe watery diarrhea, vomiting, fever, abdominal pain, and it can cause dehydration to the patient. So it is recommended to give the first dose given after the 6 weeks of age. So the next vaccine is varicella or chickenpox. It is very contagious and caused by varicella zoster virus (VZV), and it can cause blister rash, itching, tiredness, and also fever. And it is given for age 12 months and above, and it is given 2 doses more than 4 weeks apart. And the last one is the hepatitis A vaccine. It is for age above 1 year, and it is given to those with 6 to 12 months apart. Okay, next. Okay, next I will present about the controversy that around the vaccination. So the problem is from the anti-vaccine community, or we call anti-vaxxer. So the first claim that I want to present is about, they say that disease had already begun to disappear before the vaccine were introduced. So how to tackle this issue is the history shows the opposite. Because in history, there is drop in disease coincided after the introduction of vaccine. For example, in 1963, there is permanent drop in measles incidence coincided with the wide use of measles vaccine. And also, the disease also increased when there is stop of the vaccination program. It also stated in the history, like in Great Britain, there is drop in pertussis vaccination in 1974. And then in 1978, it became epidemic at the Great Britain, from into 100,000 cases and 36 deaths in 1978. And then there is other part also, other parts of the world like Japan also have the same issue lah. When there is decrease the stop in vaccination, the disease become epidemic. So the next one is about the second part is the second point that I want to say. They claim that the majority of people who get disease have been vaccinated. So actually this fact is true, but there is two factors because what it is true. Because the first factor, there is no vaccine that 100% effective, because not all people that get vaccine will develop immunity, and the effectiveness is around 85% to 95%. Okay, it is the first factor. And the second factor is the vaccinated people is outnumbered those who does not vaccinated. So it causes why the number of vaccinated people who get the disease is higher than those who does not get vaccinated. Okay, next. Okay, next. The point is they claim that vaccine cause many harmful side effects, illnesses, and even death. So how to tackle? According to study, vaccine are actually very safe, and there is some or most vaccine, there is some side effect which is very minor and temporary, like sore arm, mild fever, which can be controlled by paracetamol. And also if there is any serious adverse effect, it is very rare. It's very like 1 per million doses. So some are so rare until the risk cannot be accurately assessed. Cannot be accurately assessed the risk of getting the serious adverse effect. And then we must look for both risk and benefit in this issue. We have to look both risk and benefit. If there were no vaccine, there will be more cases of disease and death. And study shows that immunization program in US have prevent the increment of pertussis to 71-fold and death to 4-fold. So we have to look for the balance between the risk and benefit of the vaccine. So the last one, the last claim from the anti-vaxxer is that the vaccine preventable disease have been virtually eliminated from my country. This is what they claim lah. So it is true that vaccine have reduced the most disease to very low levels in some countries. but there is also other places that still has prevalence in the disease. So we don't know that if there is traveler or immigrant that can bring the disease to any country. So if there is no protection by the vaccination in the community, it will quickly spread in the community. So next, the importance of vaccination is what I said. I stated that is the herd immunity, because there is some small population in the community that cannot develop immunity from the vaccine. So it is the responsible for the others to help to protect these people. So lastly, I would like to say we should not rely on people around us to stop the spread of disease. We too must do what we can. Okay, next. So next I will present about the issue of halalness of vaccine. So first, if it is clean and pure, it is permissible in Islam. But if it is from unclean material, which is haram material, it can be divided into two. If there is no, if there's alternative way in of the vaccine, which is alternative is clean and pure, it is not permissible to have the vaccine. But if there is no alternative, it is permissible. But there are several methods that we use in this regard. So the first one is the first method is ad-darurat tubihul mahzurat, which is mean harm allows the illegitimate. So but in this method is tied with another method, which is ad-darurat tuqadiru biqadariha, which is mean that what is the in this issue, darurah is it is defined as it must really does happen and not just speculation and not just speculation in the destruction of the human life and also human property. And also there is no other alternative to prevent such harm. And also try not to choose some things that clearly violate the basic principles of Sharia and Aqidah, like kufur and killing, and also the others principle and the main principle in Islam. And also take the darurah only necessary and necessary rate only, not to be comfortable doing the forbidden thing. And in some edition, in this case, the taking of the vaccine must be recommended by doctor which is trustworthy and also expertise in this field. So next. Okay. And this is last slide. I will present about the example of fatwa about vaccine in Malaysia. So the first one is about the use of vaccine Menatra. So this is happened in 2015. They have discussed about the hukum of the use of vaccine Menatra, and the decision is permissible because there is no component that contain the ingredient, also animal sources that are doubtful from the Sharia perspective, and the processing channel also does not share with non-halal vaccine products. So then the second condition or the second cases is about the use of vaccine Biothrex and Rotatec. It is was held on 2008. The decision was not permissible because there is other alternative, and also the ingredient of the vaccine, it is come from doubtful ingredient, and there is other alternative, and also there is no strong evidence to prove that Malaysia really need the vaccine. So I think that's all from me. Any question?
Right. Brief are good. I think the specific diseases covered, as mentioned in the communication, the specific diseases that covered in the vaccine, I think will be covered throughout your course and during ID. Yeah? So any doubt or question regarding the topic that we're discussing? I think in the third year, I think that's why history of immunization is quite important. So you have to remember the schedule, because in exam definitely we're going to evaluate whether you've asked this. I mean, apart in the history, apart from saying that immunization is complete up to the age, which is what you usually mention, you have to inquire whether any adverse effect or side effect has occurred as a result of vaccination. So not enough by saying vaccination up to date. Say that you have to ask the parents as well whether any side effect occurs during the vaccination. So this is in your assessment in your long case. Not that much. Any concern or question regarding immunization? Quite clear?
Doctor?
Yep.
Does the adverse effect is same with the anaphylactic reaction?
Sorry?
Does the adverse effect is same with the anaphylactic reaction?
Anaphylactic reaction is one of the adverse effect. Okay? It's one of the adverse effect.
So if the patient like develop the adverse effect, so can we still continue with the
If
next dose?
who's the person responded presented with the absolute contraindication? So what's the answer to your friend's question? Patient has anaphylactic reaction to a specific vaccine, certain vaccine. Can you give the second dose or third dose? Is it Amir? Amir is one presenting it, is not?
Yeah. I think that we should not continue with the vaccine.
Yeah, that's that's absolute one of the absolute contraindication, right? So you had anaphylactic reaction. So just exactly like you have anaphylactic reaction to a certain antibiotic, example penicillin, documented anaphylactic reaction. So you shouldn't give penicillin to the patient in subsequent admission or subsequent needs of antibiotic. Okay, so that is absolute contraindication. Anyone else? Yeah, this is a quite straightforward topic. That's why I don't want you to present too long. It's quite straightforward. What other exam question? I think not so much. I think it's usually in your long case you will be asked to get issue from parent what type of immunization that they have received. Oh yes, remember the in 6 months MMR, those who presented just now the schedule. Only in Peninsula is no MMR at 6 months, 9 and 12 months. 6 months is actually for Sabah. The reason is actually it's more endemic in Sabah Sarawak measles, so that's why they give it earlier, 6 months in Sabah. Peninsula we give the first dose at 9 months and second dose at 12 months, right? And JE generally in Sarawak, or people in Peninsula bring their children to work in Sarawak, then you have to follow their schedule, right? For JE, but not in Peninsula. Okay, all right. Any no question, eh? Very good. Okay, then I think we end up the session. Okay, all right, guys. Assalamualaikum.
Salam. Thank you, Doctor.
Right.
Thank you, Doctor.